Hi, friends. This is Dr. Ravi Kamapali. I'm bringing to you a case series of patients who we have been able to salvage with comprehensive approach in local wound care, with vascular optimization, infectious disease approaches, and also active local wound care, but also using metabolic health optimization with nutritional optimization for diabetic limb salvage with a comprehensive metabolic heart and vascular infectious disease and wound healing approaches. I am an infectious disease doctor who is located in Georgia, and you can find me at website nobadbugs.com. And my Twitter handle, X handle, is wound physician, and hashtag removing barriers to healing is hashtag that I routinely use. My goal is nothing but helping removing barriers to healing for infection, wound healing, and obesity problems. And I'm working on a telemedicine solution that hopefully will help my patients. So this is a case of a 52-year-old female who has had history of diabetes and has had diabetes present at least for 4 years. And she had a problem with her foot that has been swollen and tender, and ended up going to urgent care on May 1st, 2023. And she ended up presenting to the office on May 5th. It was an urgent referral, and we did a quick telemedicine visit and started her on oral antibiotics, ordered a CAT scan and X-ray of the foot, and ended up following her, bringing back her to the office the next day. So she's a no smoker with diabetes, and we ended up having to admit her to the hospital because of significant worsening within 28 to 48 hours and 24 to 48 hours, and ended up putting her on IV antibiotic therapy. And also, during this course of care, we found that she needed long-term insulin therapy, but ended up having to take it off because of nutritional optimization we did. And also, we also checked her fatty liver issues. And patient did have local wound care with a close monitoring in close coordination with podiatry service, along with optimizing her nutritional status. So you will going to see some pictures here of her foot. This is the initial foot presentation. And if you see that she was noted to be having wet gangrenous changes, and if you see the foot discoloration that was noted, and we ended up having to take this off, devitalized tissue, and obviously the tissue, this area became gangrenous, dry gangrenous. Now, this was done because it was moist, and moist tissue, when there is infection under that, in the top, in the possibility of arterial insufficiency also, when there is moist wound though, that has to be removed as much as possible so that the infection does not fester under there. But yes, it went on to organize itself. She ended up getting admitted and also got discharged, and the skin improved, except it got more organized. And we ended up continuing to locally optimize it, getting her to a vascular specialist, and vascular interventions with arterial insufficiency was not found in her. So no arterial insufficiency interventions were done. So she ended up, you see that improvement here, and it was mostly she has some venous problem. And you can see sequential debridement with removal. There was some bone area exposed in the distal toe regions. And we continued with active local wound care with growth of MRSA that was noted. And also we went after sloughy material that was present here. And because sequential debridement is very much necessary with active local wound care. And slowly but steadily, this area improved. And this went on to heal. So active local wound care was also done. And as you can see, obviously we did a fibroscan. She did not have any liver scarring, but there was a lot of fat on her liver. So hopefully we'll repeat another fibroscan here after a few months to show some improvement. And as we were going through this also, we did some body composition test. Her weight did improve, but also if you can see here, her blood sugars when she was in the hospital was around 220 range, and with insulin it came down. But as we were implementing this whole solution, we ended up teaching her approaches for low carb nutrition, and she ended up getting off insulin, and her sugars are now between 100 to 125 range. And we are able to, at every visit when she comes, we are able to track and discuss with her as we are taking care of the wound. We discuss with her what she eats, and then that empowered her to understand. And she was gracious enough to give an interview, and let's listen to her.
How are you today? I'm doing good, thank you. So basically, what made you come in today?
I'm getting the last checkup of my wound and my toe that I had.
So what happened to you? What made you go to the event urgent care when you went in May?
Back in May, I woke up with a blister on my toe, and I didn't know where it came from, and it broke open, and it just got worse and wasn't healing, so I went to urgent care.
And they called me, but I was not available. So how did I take care of you at that moment?
At that moment, when I came in the office, we had a video chat over the phone on video while you were out of town. And
Started antibiotics, and we brought you back in very soon, in 48 hours or 24 hours.
yeah, you actually called me at home on a Sunday to check on me. And to make sure I was doing okay, and then tell me to come in the next day on Monday to see you.
Yeah, and then we started antibiotics. Did we go immediately to the hospital, or a few days later, or?
We went, it was a week later that he sent me to the hospital, when it was starting to
We
get.
already started some IV antibiotics, and it was not.
Yes,
working.
we started antibiotics and it wasn't working, and it wasn't looking like it was doing anything.
Yeah.
So he sent me to the hospital.
So what were your fears of the foot?
My fear was that I was actually gonna lose it, or my toe at least, and I didn't want that to happen.
Why you did not want them?
I didn't,
It's a foolish question, but that's why I'm asking you.
one, I knew I would have to learn how to walk again, and two, I don't wanna lose a toe, any part of my body.
People, they say that they rather lose their life or they're losing their toe. You know, some people, they fear that. Yeah, and I work hard to improve and prevent amputations of the toes. And tell me, how was your course? How long have you been diabetic?
About 4 years.
Okay, about 4 years. So you came to me in May 2023, on May 6th. And then we ended up, so how was your course? What were you on for diabetes?
Actually, before I came here, I wasn't on anything, because I didn't have a doctor at the time.
Okay. You did not have insurance, no?
No, I didn't have insurance, anything, so.
Okay. So basically, then we sent you to the hospital, then we just start any medication for diabetes?
They were giving me insulin every time I came in to check my sugar, and, other than that, that's all they started at the hospital, and I didn't really want to be on insulin.
Okay. Why don't you want to be on insulin?
One, because once you start it, I was told that you're not gonna be able to get off of it.
But in the hospital, initially, did they say that, what did the, food doctor tell you?
He didn't really say anything.
Possibility of losing the toe?
Yeah, other than, you know, there's a chance I can lose the child.
Okay,
And I, again, I didn't want to.
okay.
So I was willing to try anything to do anything.
So we put, initially we put, well, once we did that, we started antibiotics, we sent it out. And, we put, what do you remember we did from your foot? To change it.
We have been antibiotics, we cleaned it, and kept it clean and wrapped, and, would take off the dead
Tissue,
tissue,
and then antibiotics
and
and all
antibiotics, and all
that stuff there, okay. So tell me about your infection, you had, the wound cultures came back positive for MRSA, were you feeling what, a problem with that?
Yeah,
Yeah.
cause I, you know, honestly, I thought that was gonna be the end of that.
Okay,
I was gonna lose a toe,
okay.
and it wasn't gonna work, cause even with the antibiotics, I did the, IV antibiotics at home, it was like 2 months.
Yeah.
It
And
took,
then tell me about what were you doing for your diabetes during that time?
I cut back and started eating right, and
What
went up.
happened by, you know,
I followed your, program, and I was eating more meat and staying away from sugar foods and, you know, trying to,
so what was the monkey doing inside?
going crazy.
Yeah, the monkey was telling you to do many things,
Yeah,
and were you able to stay?
I was, and I believe I have been. You know, there's days where, you know, you want those little treats and, you know.
Yeah, but then how are you tracking that now?
Well, I check my glucose level, sugar levels every day, and, you know, I follow what I'm supposed to be eating, everything, and I keep track of it on your, Caligula.
An app that I did.
The app I made, you gave me.
Okay. And then, so what do you think, how did you get to quit your insulin?
I actually, I just stopped because I didn't think I would need it. Once I got into the, following your program and everything, and my sugars were fine and everything, so,
So how do you think the food that you're eating is a way in which you can sustain for a long time?
yes,
Yeah, and then do you think that, if you go back to the past lifestyle of eating whatever comes across, is going to cause trouble again?
Oh, yeah.
If you do that,
oh yeah, definitely.
so how are you trying to prevent that from happening?
It's hard, it's hard some days, but with exercise and, eating right, then once you get that into place, everything falls into line.
What do you do when you're addicted to the old foods? What do you do for the addiction part, the monkey that is inside?
Try and, distract myself with other things, or
So
Think
breathing
yourself.
techniques, the breathing techniques of, I told you warm water, maybe go out for a walk after you eat, or just change your mind from the thing and not have those foods in your environment. It's simple.
exactly, that, you know, I don't have a lot of the, I don't buy a lot of the foods I used to buy anymore. So it's not there for any.
So you did not have insurance at the time and you're now back and you're going to go start your job again. And now, do you think that the path of what you follow, was it affordable?
Yeah.
Okay.
Yeah,
I
it
mean,
was,
it's basically,
it was very easy.
it's very easy.
Yeah,
And then only thing is, people need help and guidance. And I'm hoping that you sustain this and stay and not be lost. And
yeah, you know, when they sent me here, I was like, didn't know what to expect.
yeah,
And, you know, most doctors, you know, don't take the time to explain everything. They just tell you what to do. And don't give you that little booster information you need to help them. And you one that gave it all, you know, you gave suggestions on how to do it and how to reach, you know.
basically what we follow is a high-tech approach. And then what we do is improve the sugar by appropriate nutritional lifestyle, but also in our center, what we get, like you for your vein problem, we got that fixed with vascular interventional cardiologist we have.
Yeah.
And then also we have this platform that we are giving you so that you understand and we are able to track your food and that help. So let me ask you a final question. What do you think you would give to a suggestion to a person like you, like the person from the next person that might suffer like this? Give up hope, not give up hope.
I wouldn't give up hope because, you know, if I had given up hope, I would have lost my toe, wouldn't have been here with a toe today, and had to learn how to walk again, and I didn't have to do anything, and it gave me hope.
So make sure that you stay on the lifestyle, okay? Yes, thank you very much.
Thank you.
How are you today?
I'm doing good.
So, how are you today?
So basically, what I want to bring to the forefront is that we have to understand that wound healing is not just about bacteria, biofilm, and tissue mechanics, but also host comorbidities. The major thing that we have to understand is nutrition, metabolic fitness, but the major thing is access to care, communication between health professionals, and getting the patients at the attention as soon as possible. And obviously, there's multiple things happening in wound healing, including genetic testing and all the other things that are happening with advanced wound care, with skin substitutes and all that. But unless the whole person approach is taken, the hole in the person will not heal easily. We have many options, including point of care solutions, but we need a platform-based approach. And healing happens by integrating people, process, and technology, but also by using professional-driven empowering solutions that are high-touch solutions that are able to deliver treatments to the patient, one patient at a time, learning from the population, but delivering solutions at one patient at a time. So we have to understand that wound care, like any other specialty, is a wait-and-see specialty. What do I mean by that? Is that, you know, the magic of art of medical care happens really in follow-up, that is tracking. And the key is that once you track, if there is an intervention that is not showing the result, then we can change. So we have to move from this mass medicine mindset and to a empowerment solution with one person, with a patient-centric approach towards removing barriers to healing. And towards that, we are working hard to take all these solutions and move medicine into that area. Thank you very much for taking time, and thank you. Take care.